Cushing's disease, or hyperadrenalism, is the opposite of Addison's disease, and it is characterized by excess glucocorticoid production or exposure to glucocorticoids in excess. So remember, cortisol, also called hydrocortisone, is released in response to stress. It has a supportive action in response to stress. It stimulates gluconeogenesis, it mobilizes fats, and it elevates the blood glucose levels. It also has an anti-inflammatory action. In Cushing's disease, there is excess glucocorticoid production or exposure and excess mineralocorticoid. And so we see retained fluid and retained sodium. Physical characteristics of Cushing's disease include a buffalo hump, which is abnormal fat distribution around the upper part of the back and shoulders, and moon facies, in which the face appears round. Here's an example of a buffalo hump. And this is what moon facies looks like. In advanced Cushing's, the patient may demonstrate what is known as centripetal obesity, where is this large fat deposition around the central part of the body. So Cushing's disease is excess adrenal production, excess glucocorticoid production, and this results in insulin resistance. So diabetes results from this pancreatic burnout. See, the severely overstimulated insulin production in the pancreas results in eventual failure. So Cushing's disease has various causes. Prolonged administration of high doses of corticosteroids is one cause of Cushing's disease. Adrenocorticotropic hormone secreting pituitary tumor can be another cause, because if ACTH is being secreted by a pituitary tumor, it will stimulate the adrenal glands to release more corticosteroids. An adenoma of the adrenal cortex that secretes excess cortisol is another cause of Cushing's disease. And any malignant growth that synthesizes adrenocorticotropic hormone will stimulate the adrenal glands and cause Cushing's disease as well. So if Cushing's disease is caused by a pituitary tumor, then surgical removal of the pituitary tumor using the transsphenoidal approach may be necessary. The tumor may also be irradiated with radiation therapy. If Cushing's disease is caused by an adrenal tumor, then surgical removal of the tumor via adrenalectomy is possible, and this can be done laparoscopically. Radiation may also be a treatment for a tumor in this case, and there are also medications that inhibit cortisol. Nizoral is an example, and this has anti-cortisol properties when it's given systemically. This is an example of what a woman looks like before treatment with Cushing's disease. And here's a picture of the same woman following extensive treatment. If Cushing's disease is caused by excessive corticosteroid use, then we want to gradually taper all corticosteroids. And anytime anyone has long-term corticosteroid use, it should be tapered before it is stopped. The reason for this is because patients on large doses of oral corticosteroids are actually suppressing ACTH production. And these patients are now no longer making endogenous cortisol because of this ACTH suppression. If these patients are made NPO, they have no source of glucocorticoids. So although chronic large doses of corticosteroids may give them a Cushingoid appearance, acutely removing corticosteroids may cause a severe Addisonian crisis. So remember, patients on chronic large doses of oral glucocorticoids, prednisone and methylprednisolone, need IV replacement if they are made NPO for any reason. So nursing considerations in Cushing's Obviously, emotional support is going to be a huge factor because these changes in their appearance can be distressing. Centripetal obesity, we saw a picture of earlier. Hirsutism in women, which is the excessive growth of hair on the face, and gynecomastia in men. So we want to reassure the patient that the physical changes and the emotional lability may resolve following their treatment. Now we're going to talk about hyperaldosteronism.